Hello everyone and welcome back to my channel. In this video, I will be discussing the causes, symptoms, and treatment options for hernia. I will also be sharing some tips for preventing and managing fatty tissue protrudes. I hope that this video is helpful for anyone who is suffering from hernia or is interested in learning more about this common fact for infection. A hernia is a condition in which an organ or fatty tissue protrudes through a weak spot or tear in the surrounding muscles or tissues. This can cause pain, discomfort, and in some cases, serious complications if left untreated. The most common types of hernias include inguinal, in the groin, umbilical, around the belly button, and hiatal, in the upper stomach. Treatment for a hernia typically involves surgery to repair the weakened area and prevent the hernia from recurring. The main cause of hernias is a combination of muscle weakness and strain or pressure on the affected area. Some common factors that can contribute to the development of a hernia include 1. Age-related muscle weakness. As we age, our muscles naturally weaken, making it more likely for hernias to develop. 2. Straining during bowel movements or urination. Chronic constipation, diarrhea, or frequent heavy lifting can increase pressure on the abdominal muscles and lead to a hernia. 3. Pregnancy. The increased abdominal pressure during pregnancy can cause a hernia to develop in some women. 4. Persistent coughing or sneezing. Chronic coughing, such as from smoker's cough or conditions like bronchitis, can strain the abdominal muscles and lead to hernias. 5. Obesity. Excess weight can put extra strain on the abdominal muscles and increase the risk of developing a hernia. 6. Family history. There may be a genetic component that predisposes some individuals to hernias. It's important to note that hernias can also occur without a specific cause, as some people may have a natural weakness in their abdominal wall that predisposes them to developing a hernia. There are several types of hernias, which are classified based on their location in the body. The most common types of hernias include 1. Inguinal hernia. This type of hernia occurs when a portion of the small intestine or fat pushes through the inguinal canal in the groin area. Inguinal hernias are more common in men and are often caused by a weakness in the abdominal wall. 2. Hiatal hernia. A hiatal hernia occurs when a portion of the stomach pushes up into the chest through the diaphragm. This can cause symptoms such as heartburn, acid reflux, and difficulty swallowing. 3. Umbilical hernia. An umbilical hernia occurs when part of the intestine or abdominal lining protrudes through the abdominal muscles near the belly button. This type of hernia is more common in infants but can also occur in adults. 4. Incisional hernia. An incisional hernia develops at the site of a previous surgical incision in the abdominal wall. This can happen if the incision site does not heal properly or if the abdominal muscles weaken. 5. Femoral hernia. A femoral hernia occurs when the intestine or abdominal tissue pushes through the wall of the femoral canal in the groin area. This type of hernia is more common in women. Other less common types of hernias include epigastric hernias, Spigelian hernias, and obturator hernias. Each type of hernia requires specific treatment and management, so it is important to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. The symptoms of a hernia can vary depending on the type and location of the hernia. Common signs and symptoms of a hernia may include 1. A noticeable bulge or lump in the affected area, which may become more prominent when standing, coughing, or straining. 2. Pain or discomfort in the area of the bulge, particularly when lifting heavy objects, bending over, or coughing. 3. A feeling of heaviness or pressure in the abdomen. 4. Heartburn or chest pain, in the case of hiatal hernias. 5. Swelling or tenderness in the abdomen or groin. 6. Nausea or vomiting. 7. Difficulty swallowing or painful swallowing, in the case of hiatal hernias. 8. Acid reflux or regurgitation of stomach acid into the esophagus, in the case of hiatal hernias. It's important to seek medical attention if you experience any of these symptoms, as untreated hernias can lead to serious complications such as strangulation, in which the blood supply to the herniated tissue is cut off. If you suspect you have a hernia, your doctor can perform a physical examination and imaging tests to confirm the diagnosis and recommend appropriate treatment. There are several risk factors that can increase the likelihood of developing a hernia. Some common risk factors include: 1. Age. Hernias are more common in older adults, as aging can weaken the abdominal muscles over time. 2. Gender. Certain types of hernias, such as inguinal hernias, are more common in men than in women. 3. Family history. Having a family history of hernias can increase the risk of developing a hernia, as there may be a genetic predisposition to weakened abdominal muscles. 4. Chronic coughing or lung disease. Conditions that cause chronic coughing, such as bronchitis, asthma, or smoker's cough, can strain the abdominal muscles and increase the risk of developing a hernia. 5. Obesity. Excess weight can put pressure on the abdominal muscles and increase the risk of developing a hernia. 6. Pregnancy. The increased abdominal pressure during pregnancy can weaken the abdominal muscles and lead to the development of a hernia in some women. 7. Previous abdominal surgery. Having undergone previous abdominal surgery can weaken the abdominal muscles and increase the risk of developing an incisional hernia at the surgical site. 8. Heavy lifting. Lifting heavy objects improperly or frequently can strain the abdominal muscles and increase the risk of a hernia. 9. Constipation. Chronic constipation and straining during bowel movements can increase pressure on the abdominal muscles and contribute to the development of a hernia. It's important to be aware of these risk factors and take preventive measures to reduce the likelihood of developing a hernia. If you have one or more risk factors for hernias, it's important to consult with a healthcare professional for evaluation and appropriate management. While hernias cannot always be prevented, there are measures that can help reduce the risk of developing a hernia. Some tips for hernia prevention include: 1. Maintain a healthy weight. Excess weight can put strain on the abdominal muscles and increase the risk of developing a hernia. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce this risk. 2. Avoid heavy lifting. Lifting heavy objects improperly can strain the abdominal muscles and increase the risk of a hernia. If you need to lift something heavy, use proper lifting techniques and ask for help if needed. 3. Avoid straining during bowel movements. Straining during bowel movements can put pressure on the abdominal muscles and increase the risk of a hernia. Eating a high-fiber diet, staying hydrated, and practicing good bowel habits can help prevent constipation and reduce straining. 4. Quit smoking. Smoking can weaken the abdominal muscles and increase the risk of developing a hernia. Quitting smoking can improve overall health and reduce the risk of hernias. 5. Treat a persistent cough. Chronic coughing can strain the abdominal muscles and increase the risk of a hernia. Treating underlying conditions that cause a persistent cough, such as asthma or bronchitis, can help prevent hernias. 6. Practice good posture. Maintaining good posture can help prevent strain on the abdominal muscles and reduce the risk of developing a hernia. While these measures can help reduce the risk of hernias, it's important to remember that some hernias may occur without a specific cause. If you suspect you have a hernia or are at risk for developing one, consult with a healthcare professional for evaluation and appropriate management. The treatment options for a hernia typically involve surgical repair to alleviate symptoms, prevent complications, and reduce the risk of the hernia recurring. Some common treatment options for hernias include: 1. Watchful waiting. In some cases, especially with small, asymptomatic hernias, doctors may recommend a wait-and-see approach. However, it's important to monitor the hernia regularly and seek medical attention if symptoms develop or worsen. 2. Hernia truss or supportive garment. For individuals who are not surgical candidates or prefer non-surgical options, a hernia truss or supportive garment may be recommended to help support the weakened area and reduce discomfort. 3. Laparoscopic hernia repair. Laparoscopic surgery is a minimally invasive procedure that involves making small incisions and inserting a camera and surgical instruments to repair the hernia. This approach typically results in less scarring, quicker recovery, and faster return to normal activities compared to open surgery. For open hernia repair, traditional open surgery involves making a larger incision over the hernia site to repair the weakened area and reinforce it with synthetic mesh or sutures. 5. Robotic-assisted hernia repair. Robotic-assisted surgery combines the precision of robotic technology with the expertise of the surgeon to repair the hernia. This approach may result in reduced pain and quicker recovery compared to open surgery. 6. Lifestyle modifications. Making certain lifestyle changes, such as maintaining a healthy weight, avoiding heavy lifting, treating underlying conditions like chronic cough or constipation, and practicing good bowel habits, can help reduce the risk of hernia recurrence. The appropriate treatment option for a hernia depends on factors such as the type and size of the hernia, the presence of symptoms, the individual's overall health, and personal preferences. It's important to consult with a healthcare professional to determine the best course of action for your specific situation. Medications are not typically used to cure hernias, as the primary treatment for hernias is surgical repair to address the structural weakness in the abdominal wall. However, medications may be prescribed to manage symptoms associated with hernias or to address complications that may arise. Here are some medications that may be used in the management of hernias. 1. Pain medication. Over-the-counter or prescription pain relievers may be recommended to help alleviate pain or discomfort associated with a hernia. 2. Antacids or acid-reducing medications. For individuals with hiatal hernias experiencing symptoms such as heartburn or acid reflux, antacids or medications that reduce stomach acid production may be prescribed to manage these symptoms. 3. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs, NSAIDs, may be used to reduce inflammation and pain associated with hernias or following hernia repair surgery. 4. Antibiotics. In some cases, antibiotics may be prescribed to prevent or treat infections that may occur due to a hernia complication, such as a strangulated hernia. It's important to note that while medications can help manage symptoms associated with hernias, they are not a cure for the underlying structural weakness that causes hernias. Surgical repair remains the primary treatment for hernias to prevent complications and reduce the risk of hernia recurrence. If you have a hernia or suspect you may have one, it's essential to consult with a healthcare professional for an accurate diagnosis and appropriate management plan tailored to your specific needs. Medications used to manage hernias, such as pain relievers, antacids, anti-inflammatory drugs, and antibiotics, may have potential side effects. It's important to consult with your healthcare provider about the risks and benefits of these medications and to closely follow their guidance for safe and effective use. Some common side effects associated with medications used to manage hernias may include 1. Pain relievers, e.g., acetaminophen, ibuprofen. Common side effects may include upset stomach, nausea, and gastrointestinal irritation. Prolonged or high-dose use of nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen may increase the risk of stomach ulcers, gastrointestinal bleeding, and kidney damage. 2. Antacids or acid-reducing medications, e.g., proton pump inhibitors. Side effects may include headache, diarrhea, constipation, and abdominal pain. Long-term use of proton pump inhibitors may be associated with increased risk of fractures, kidney damage, and nutrient deficiencies. 3. Anti-inflammatory medications, e.g., NSAIDs. Side effects may include stomach upset, ulcers, gastrointestinal bleeding, and kidney damage. NSAIDs may increase the risk of heart attack or stroke, particularly in individuals with cardiovascular risk factors. 4. Antibiotics. Common side effects may include nausea, diarrhea, and stomach upset. Some antibiotics may cause allergic reactions, such as rash, itching, or difficulty breathing. It's essential to inform your healthcare provider about any known allergies, medical conditions, or other medications you are taking to help minimize the risk of adverse reactions.